Hi, my name is Kate Bandatini, and I'm a first-year chemical engineering student here at OSU.
Hello, my name is Hannah Briggs, and I am a first year biohealth sciences student, also here at OSU.
My name's Nisa Ingabo, and I am a first year bioengineering student.
I'm Cameron Smith, and I'm a fifth-year environmental engineering major.
I'm Anna Sosnowski, and I'm a second year studying environmental engineering.
My name is Brooke Adaviri, and I'm a second year mechanical and manufacturing engineering student.
We are here today to talk to you about our project, Material Science and Menstrual Health and Hygiene. Our project focuses on the barriers that women face when it comes to menstrual health and hygiene, including lack of access to safe menstrual products, affordability, and sustainability. The focus of this project is to apply engineering skills to develop a biodegradable, compostable sanitary pad containing superabsorbent polymers to address these menstrual health and hygiene needs. For our research process, we started with the reverse engineering of a few leading commercial menstrual pads into prototypes. And we first started with SAP absorbency testing, which is where we tested liquid absorbed by different superabsorbent polymers, or SAPs, and PLA top sheets. And then we also did wetback testing, which is how much liquid is absorbed into the pad and how it may feel to the skin. And then as well as drip testing, which is how much liquid is moved throughout the pad once it is absorbed. And for future testing, we plan on doing some adhesion testing, which tests how well the pad will stick to the undergarment, as well as developing foam layers into the prototype, and possibly testing hemp and bamboo material for the middle layer within the pad.
As Kate said in the last slide, one of the tests that we did was absorbency testing. And this is where we tested different superabsorbent polymers. We tested them with both DI water and salt water. And we tested ChemSol, which is a non-biodegradable SAP, as kind of a control, as well as 3 different sizes of Ziba. So Ziba SP is the smallest, Ziba RD is in the middle, and Ziba XL is the largest. And as you can see, we had the best results with Ziba RD. So we decided to move forward with that when building our prototype. And there's some pictures in the bottom left, and that just kind of shows what our tests look like. That's the SAP when it's fully saturated. If we go to the next slide, we can look at the prototype that we've been working on the past few weeks. So as you can see from the picture, there's about 3 different layers. The top is just a cotton top sheet, and we tested several ones of these for different properties that they had, and we ended up deciding on the brand Unitica, and the specific model of the sheet was UO305-A25. The middle layer is a combination of 10 cell cotton fibers, and that's blended with the superabsorbent polymer, which is the Ziba RD, as we've decided in our absorbency tests. And the bottom layer is actually a compostable garbage bag from the brand Glad.
We're currently working in the community of Moanatlala, Botswana, which is a small rural village in central Botswana with about 5,000 residents. Our target group is women in need of menstrual health resources between the ages of 15 to 45 years old. And in our research before we decided to work on this project, 80% of the women that we surveyed said that commercial pads are either unavailable or unaffordable, and approximately 30% of the girls that are school age miss 2 to 3 days of school a month due to lack of menstrual health resources. Our current barriers that we're working on are cost, sustainability, biodegradability, and cultural acceptability of the products. And our goal is to improve the health and well-being of women using our discreet prototype and sanitary pad through engagement with the local community, government, and academia. One of our mentors, Dr. Sunil Khanna, is already working with the Botswana Global Health Program to better understand the needs of the people within the village and the culture surrounding it. Our future plan is to travel to Botswana in summer 2022 and deliver 1,500 biodegradable pads to the women there, as well as teach them how to use the pads.
Getting into the composting portion of the project. So an ideal composting box, as shown in the right, or shown in the picture on the right, requires certain materials and conditions to help aid in the biodegradation process of the pads. And this includes moisture, heat with temperatures ranging from 90 to 150 degrees Fahrenheit, total dry solids to be between 50 and 55%, organics to be present in the compost medium, and this can be in the form of plant waste, manure, and other types of green mixtures, and then also the presence of oxygen, or for it to be well aerated, and this can be achieved by mixing. For implementing composting in Botswana, composting boxes and stations can be applied in homes and or in the community centers. And there's also the option of composting in a hole in the ground at a depth of 12 to 16 inches, where worms will also be present to degrade the pads.
Now, there are some concerns regarding the spread of HIV through menstrual hygienic products. In our Botswanian community, nearly 28% of residents who live here have HIV. This should be taken into consideration regarding the handling of our pads and their compostability. As described in the previous slide, if sanitary measures are followed, compostable boxes and deep enough holes, 12 to 16 inches into the ground, should help to eradicate HIV transfer. When pads are placed in the ground or in compostable boxes, the virus becomes inactive. In other words, the virus is only active in human hosts. As the pad breaks down over time, the virus becomes unable to reproduce, and after 7 days, it fully dies. It is also unable to reduce in temperatures greater than 25 degrees Celsius, thus making compostability really beneficial to killing the virus. If we compost our pads and allow them to completely decompose, the HIV crisis should be able to be effectively handled using our biodegradable pads.
Once we have assembled all of the materials, the plan for manufacturing the menstrual pads is to cut them using molds. A mold prototype has been designed on a SolidWorks as shown in the bottom right picture. It is currently in the process of being 3D printed in our polymer lab, and the final die will be machined from aluminum on a CNC mill here at OSU. We will implement a production line in the polymer lab with the goal of producing 1,500 pads to begin with for this study. Thank you for listening to our presentation. A special thank you to our mentors, Dr. Skip and Dr. Sunil Khanna, for their support and guidance.